Hello everyone. Welcome to another live stream. I hope you're all doing well. I'm Dr. Sylvia. Happy Mother's Day to everybody who's marking it today. I hope all moms out there, I hope you've had a special day. I hope you've been celebrated. And even if you haven't, I am celebrating you today. Just being somebody who is a mom or performs the role of a mom to anyone or any group of people. That's such a remarkable job, a remarkable privilege, a lot of sacrifice. But celebrating all moms out there today. You guys are amazing. We are amazing. Thank you so very much for everything that you're doing. So welcome to another live stream, and we're talking about headaches and migraines. And I just wanted to have a chat. I wanted to have a chat with us about these subjects. I come across a lot of the time because, headaches are so common. People who come to talk about their headaches, and when you ask them, do you suffer from migraines? And people say yes. And then you have to dig deeper. Well, I find as a clinician, I have to dig deeper to find out, well, what do you mean by migraine? Because many people take a migraine to be a very, very severe, painful headache, which it is. But what they are describing as migraine is not the medical definition of migraine. And so I wanted to talk to us a little bit about what headaches and migraines are and their differences. So that's what we're going to be looking at in this live stream. And hopefully by the end, we should have some clarity. We should be able to distinguish. And if somebody says you suffer from migraines, then you know what they mean. And you'll be able to say yes or no, depending on the nature of the migraines or the headaches that you've had and treatments and so on. So that's what we're going to do today. That's the plan. Thank you so much. If you're joining the stream live, you're very much welcome. Let me know where you're watching from. And yeah, I'd love to know what your experience with headaches or migraines is or has been, what your symptoms have been, what kind of treatments, challenges getting treatments, what's worked for you, what hasn't, and so on. Please feel free to share if you want to. Of course, by way of quick disclaimer, just to remind you that here we're providing information for guidance and to help to signpost people. I can't make a diagnosis on here. I'm not going to respond to any questions about what can I take for this or the other. I'm not going to do that. Excuse me. But I will be very happy to for us to have a discussion, expand our knowledge about headaches and migraines. That's the intent that's the intent of our chat, and that's the intent of our conversation today. So let's get started. We know what headaches are. Any kind of pain or pressure, discomfort. What other words can we think of? Tightness, pounding. What else? Stabbing, throbbing, any kind of pain. There's so many different ways that you can describe the pain, but any pain that's affecting the head, the face, and the neck. So generally, a headache is that any kind of pain or pressure that is around the head can affect the face or the upper neck. That is generally what a headache is. And so you can imagine that there are lots of different types of headaches. Many of us would routinely have headache, maybe because we're tired or we've been sitting at the computer for too long. That's not an unusual cause of a headache. Somebody who's been at the computer for ages and they're experiencing a headache, or they've had a very busy day, or they're feeling stressed. Different reasons that we could have headaches. So There are different types of headaches, but mainly we have primary and secondary headaches. Primary headaches are conditions that cause the pain in the head or the neck or the face that are not as a result of a separate medical condition. So they are conditions that just develop and lead to pain in the head or lead to the headache. While secondary headaches are as a result of some other medical problem. So something else is going on and that leads to a headache. And I've just been talking about something like stress, or somebody who's unwell with high blood pressure, for example, or somebody who has a brain cancer. It might be as a result, side effect from some medication or other conditions. So there is a medical problem which leads to the development of the headache. The headache is one of the complications of that condition. That's a secondary headache. And that's quite different from primary headaches, where they begin themselves, they are independent. That is the condition. The condition itself is the headache. So examples of primary headaches are migraine, which we're going to be talking a little bit more about today, but also something called tension headache or tension type headache, or cluster headache, or hemicrania. So we're just going to talk a little bit about those. I don't want this to be too technical, but I really wanted to make sure that we're clear, and then we'll spend a bit more time talking about migraines. Guys, please give this video a like. Let me just share my ticker. And if you're watching the replay later on, I'd love to get comments from you about any types of headaches that you've had before, what your experience has been with headaches. So yeah, please don't forget to like the video and of course share it. And if you found it helpful, that would be fantastic. Talking about headaches and migraines. And we've just finished saying that headaches can be split broadly into two types, primary or secondary, where secondary, there is an underlying medical condition, while primary, there isn't. It's an independent condition, which is the headache itself. While secondary, there's something else that's going on. There is some other condition that then leads to headaches developing. So we're just looking at types of primary headache, and we mentioned tension type headache. So, people who have a tension type headache will often complain about something, and they describe it like a tight band around the head. Tight, feeling that pressure around the head. That's usually the kind of description somebody who's experiencing a tension headache would talk about. And it might be a chronic type of tension headache, which is when they are experiencing a headache for more than half the month, so more than 15 days of the month. Tension type headaches are the most common type of primary headache disorder. Surprisingly, you might have thought that it would be migraines, but actually tension headaches are more common. And most people would experience the chronic type. So they're experiencing it for more than half of the month. That's quite a long time to be so uncomfortable, so much in pain with that kind of headache. There's the other type, which is episodic, in which the headache is happening fewer than 15 days a month. So, like I said, people who have a tension type headache would complain about that feeling of tightness around the head. So there could be different reasons that a person has a tension type headache. Remember, it's a primary type of headache. Excuse me. So that means there necessarily isn't an underlying condition that leads to this headache happening, although it may occur in certain illnesses. So, for example, people who develop tension headaches are people who maybe have stiffness around the jaw, or they're clenching the jaw. I don't know if you know anyone, or if you're somebody who clenches your jaw quite frequently. And sometimes that can be a sign of stress or distress, or anger and so on. That can lead to a tension type headache. Other issues or other factors that could be related with a tension type headache are being hungry, lack of sleep or insomnia. If you've been straining the neck, so if your posture is not very good, maybe you're working at the computer, working at the desk, and you're not sitting in a very good chair, or you're having to bend the neck, so that sort of translates across, because the muscle coming from the skull down into the neck will be under strain, as well as the other tissues of the neck, and that can translate to that type of headache if the neck is not properly postured when you're sitting or when you're working or whatever it is that you're doing. So things like stress, poor posture, straining the neck, poor sleep, hunger, even mood problems like anxiety or depression could be associated with tension type headache. Okay, so let's keep that in mind, that many of us could experience tension headache. It could be because we're stressed. It could be because we are tired, hungry, not sleeping well. Some people that have the bad habit of clenching the jaw. I'm just doing it now. When you clench the jaw, feel the pull, the strain, that tightness. You can feel that. I can actually feel it around my head as I clench my jaw. So that's tension type headache that we've just been talking about. And if you suffer with that kind of headache, let me know in the comment section. Hi to NF, who says, I get a monthly migraine on the 4th day of my non-active sugar pill of my birth control pack. I can't deal with sound or light and have nausea or vomiting. Oh dear. Yeah, headaches can be associated with hormone changes. So yeah, that does sound like a migraine. I mean, we're going to talk about migraine symptoms a little bit later, but dealing with sound or light, nausea and vomiting. Yeah, thanks for sharing that. I was just saying at the beginning that many people talk about headache. And if you ask them, do you suffer with migraines? And they say yes, because they are thinking about a very bad migraine. Oh, sorry, I don't want to confuse things now. They say yes because they're thinking of a very bad headache. So not all bad headaches are migraines. And I would like us to establish that distinction, that not all bad headaches are migraines. It is true that migraines are very severe, high intensity headaches, but they have a particular characteristic feature most of the time that differentiates them from other headaches. And when the doctor is asking you if you suffer with migraines, there are good reasons for us to be clear in our head, so that we know, is this somebody who suffers with migraines? Are there certain treatments they can or cannot have? But if the doctor asks you, do you have migraines? And if you've not been diagnosed with migraines, you've not been treated with migraines, and you just assume that because you suffer with very painful headaches that you must be migraines, and you say yes, then you're not giving the right answer. And of course, I know it's because you don't realize, and that's why we're having this conversation. But going back to NF's comment here, getting a monthly migraine on the 4th day of my non-active sugar pill. So that's the withdrawal period. That is quite common, actually. That headache is quite common when you're on the withdrawal, or when you're in the inactive part of your pill. So when you're not taking the hormones, that withdrawal period is usually associated with headaches in some ladies. So there is a recognized relationship between hormones and headaches, and migraine headaches as well. All right, so that's tension type headaches. You're talking about the different types of headaches and looking at migraines. so that when we're using the term headache and we're using the term migraine, we're clear in our heads what we're talking about. So we've just looked at one of the primary types of headaches or primary headaches, which is the tension headache. So another one is the cluster headache. Oh, thank you. Thank you. Thank you so much for sharing. It's really useful to get feedback. I appreciate that. Thank you. All right. So we are talking about cluster headaches now, another type of primary headache. And if you're just joining, we've distinguished between primary and secondary headaches. We've said that secondary headaches is usually a medical condition behind the headache is as a result of something underlying, and it can be brain tumors, a stroke, medication, head injury that lead to headaches as complication, different from primary headaches where the headache is independent of any other condition, even though it could happen in the context of certain problems like stress or poor sleep or depression and so on. And we're looking at types of primary headache, and migraine is one of them. But we've just talked about tension, and we're going to talk about the cluster headache, which I don't know if anybody has heard about cluster headaches before, but they are pretty much what that sounds like. Headaches that come in clusters, in groups, which can be really uncomfortable. So cluster headaches cause I've just managed to spill water on my computer, which is fantastic. Okay, so cluster headaches cause severe pain, usually on one side of the head. Okay, so that's something that's important, on one side of the head. I didn't say that about tension headache. Tension headache, usually people will talk about a tight band around the head, but cluster headaches are that headache that stops you. Your hand is on one side of the head because that's where that headache is. Severe pain on one side of the head, often behind the eye, and they come in clusters. So what that means is that a person might have lots of headaches around the same time every day for a number of weeks. And it tends to happen as a cycle as well. So a person might, around 9 or 10 o'clock in the morning, start getting those headaches, and they just go on for some time. It may be between 15 minutes to a couple of hours that the headache happens, then a little bit of a break, and then it comes back again, a little bit of a break, and then it comes back again. Sometimes people could have nearly 8 or 10, or well, it varies. Some people might have 2 or 3, some people might have more headaches per day, and then that happens again the next day. So that's quite a nasty kind of experience. It's really uncomfortable. Of course, none of these headaches are comfortable, but just imagine this pattern where somebody is just having this occurring every single day and so severe, you can't really do anything with yourself. Now, these headaches actually, interestingly, are more common in men than in women. Remember, I was just saying in response to the comments from NF just now about her about the migraine headaches when she's off her pill, off the active phase of her pill. Headaches can be quite common in women, but these cluster headaches in particular tend to be more common in men, although they're a less common type of headache in the overall group or classification of primary headaches. So generally, somebody with cluster headaches will talk about really bad pain, and it's usually on one side of the head. The pain is behind the eye. And they have eyes that are usually quite red and watery. So if you can just imagine somebody looking very, very distressed, and they're holding their hand to one head, and the eye is red, the eyes are red and they're watering, as if they're crying. They might look as if they've got a bad cold, blocked nose, and you usually look quite uncomfortable. They might be sweating. just very restless. I think it's a really uncomfortable condition, really, to have. So those are cluster type headaches. And it's useful to know what kind of, because headaches tend to have things that we call triggers, and a trigger is something that could provoke the headache or bring it on. Sometimes there isn't. People might just wake up, or they're just minding their business and suddenly the headache starts. But in certain cases, for example, cluster headaches, there may be some triggers that actually bring on this headache, which it will be very good for people who experience them to identify the triggers, because when you avoid them, then hopefully you're less likely to have those headaches. So examples of triggers that you could have with tension headaches are things like drinking alcohol, smoking. For some people, it's some type of physical activity, maybe running, or if they're at the gym, the cluster headache starts. So some people, it smells. Some smells, maybe nail polish or nail varnish or paint or perfume could just trigger the headache and it starts off. So that's cluster headaches, series of headaches, usually quite uncomfortable, usually on one side of the head. Very, very distressing. Groups of headaches that just happen. They give a little gap, but before you can recover, another one starts off again. The person might have 2, 3, or more headaches in a day, like that, and it might go on about the same time the next day. Really uncomfortable, and sometimes the individual might notice that there's a trigger, which could be smoking, or if they take alcohol, or if they smell something, and it's something that's more common in men. Okay, so let's talk about another type of primary headache before we go on to migraines, and this is called hemicrania. Hemicrania, that means one half of the skull. Cranium is the skull or the brain box. Hemi is half. So hemicrania, these are persistent headaches. So these are headaches that they don't just, happen and then get better after half an hour, after an hour, or if you've taken some painkiller. They just continue. They're just continuous. Many, many times I've come across people who just, for some reason, I've got a headache and it started 3, 4 days ago. It's not getting better. I've taken paracetamol, I've taken this, I've taken that. It's not getting better. And sometimes you can't work out what brings it on. Sometimes we need to sort of sit down and explore what's been going on, because so many different things could be associated with developing headaches. For example, in the context of being unwell with a fever, like malaria, for example, or somebody with the flu, or somebody with a urine or bladder infection, and so on, could have headaches. And I'm just talking generally. But when people come in with complaints about persistent headache, then it's the part of our job is to try and work out what's been going on in the last few days or weeks to have resulted or have led you to develop this headache. But back to hemicrania. So these are persistent headaches. They can be quite severe, but other times they can be less. They can be tolerable. So that's one thing that characterizes them. That sometimes they can be quite bad headaches, but other times they're not so severe. And again, they can affect both sides of the head, but usually they come on one side. So I know if you've been listening, if you've been listening to me from the beginning, I haven't talked about migraine yet, but already we have a couple of headache types that seem to affect one side of the head. And this is one of the reasons why I think that many people, if you ask them, oh, do you suffer with migraines? They may not actually have a migraine, but because they know a little bit of migraine being a very, very bad headache, and usually on one side they'll say yes, but it may not be that they've got a migraine. So we're still talking about hemicrania. Again, people can have chronic headaches. They might have headaches every day. They might have headaches twice or thrice a day, or even more. And some people could have recurring headaches every day for several months, and then it goes away for a few weeks and then comes back. If somebody's having this type of headaches, they may also have things like they might feel sick, or they might actually be sick, so they might vomit alongside the headache. They may also have watering eyes, like what we saw with the cluster headaches. They may be sensitive to light and sound. They may just be congested. You might notice they've got swollen eyes. They just appear generally unwell. Now, in this one, this hemicrania, unlike the cluster headache, this appears more common in females than in males. So if we're seeing people coming in with a type of headache, their sex could be important, because it might suggest that it's more likely to be this headache than the other. So that's, that information could be useful. It also has triggers such as alcohol and exercise. So one of the things that's really important for somebody who has headaches is keeping a headache diary. And it might seem like a waste of time, but I promise you that when you have headaches that appear similar, because that's one of the biggest problems that we can have in terms of finding the right treatment, and our patients complain, oh, the headache is not getting better, this treatment is not working, and so on, is some of the symptoms of these headaches, or the features of these headaches, can overlap. They can overlap. So we've already talked about two different types of headaches now, where you have watering, where you could have nausea, you could have vomiting, where you could have different symptoms. And so you're having to shake your head as a clinician to work out which is it then. Is it hemicrania? Is it cluster headache? Because in both of them, you could have persistent headache. They could be on one side of the head. You could have 3 to 4 or 5 headaches every day in both of them. They may carry on for several weeks or months before a little bit of a break. So sometimes it might be tricky. But what could help to clinch the diagnosis may be a pattern diary, where you would record each time you have a headache, how long it lasts for, if there was anything that you were doing or you think might have triggered it, and continue to maintain that for many, many days or weeks, or however long that you're experiencing them. That could help your clinician, whether it's your GP or your neurologist, to put it all together and identify that it's more likely to be this one than the other, and that hopefully will help with the right treatment, because some of these things can have very different treatments. All right, so that's hemicrania. That's a type of primary headache. Triggers, we said, can be exercise, can be alcohol, and we've also said that it's more common in women than in men, which is different from cluster headaches. Okay, so we've looked at 3 types of primary headache. We've looked at 3 different types of primary headache, and we're going to talk about migraines in a minute. So NF is saying, do you recommend acetaminophen? Do you recommend acetaminophen or ibuprofen more for non-prescription headache relief? So for those, acetaminophen is paracetamol, or ibuprofen more for non-prescription. Both of them can be effective. And thanks for the question. Both of them can be effective. And it depends on the individual, really. We'd usually ask you to start with paracetamol. And if that doesn't have any effect, then you could use ibuprofen as over-the-counter. Simple, those are the first painkillers, the first go-to painkillers, really, for treatment. Ibuprofen is a non-steroidal anti-inflammatory medicine. So it may be that if there's some inflammation going on as the headache, it might help in addition. So it will help to reduce inflammation and help to control pain as a result of that. So ibuprofen can be useful for that purpose. But either of them is acceptable. Don't forget, there's some people who can't even tolerate ibuprofen. So there is no one that is particularly stronger than the other. But they work differently. That's the important thing to say. They're different class of drugs, and they're the first line, if you like, and they should provide similar levels of pain control. Some people can have ibuprofen. Some people can't have ibuprofen. And don't forget that ibuprofen should always be taken after food and not on an empty stomach. So just a few points about over-the-counter painkillers. Paracetamol, simple paracetamol can be quite useful. I know it's very, very common, but it can be quite useful as a baseline. And sometimes I find that people, excuse me, sometimes I find people don't bother because everybody knows paracetamol. So they don't bother because they think it's not going to work, but you might be surprised actually. And the other thing that's actually surprising is that people don't take the right dose of paracetamol. So please, please look at the information leaflet just to make sure you're taking the right dose for your age and size. NFU are very welcome. Thank you. Okay, so let us go to migraines. We are talking about the difference between migraine and headaches and just trying to explore that term headache. We know that headache refers to any pain or pressure around the head, might involve the face and go on to the upper neck or above the shoulders. All that can refer to headache. And my experience is many times if you ask somebody, do you suffer from migraines? Most people, and I may be wrong, this is just anecdotal, I haven't done any proper study. Most people will say, oh, yes, I have migraine, because they're referring to a very, very, what they feel is a very severe headache. And all I want to say is that until we explore that particular headache, we don't know if it's a migraine or not. It might be that it's a very severe headache, but there are other causes of very severe headache. So let us now look at migraines. What are migraine headaches? So migraines are extremely painful, intense primary headache. So there's no medical condition that is underlying. There's no brain cancer or head injury or anything else that resulted in the migraine developing. It's an independent primary headache. So it's quite intense. People will talk about throbbing pain and really makes people unwell. Really, they can't function. I think that's a word I'm trying to look for. They can't function. So usually intense, the head is throbbing, usually on one side. And I'm saying usually because just like many, many other things in medicine, you might have a classic way that things would present. And then you have then the same thing can present in a slightly different way, but it's still that same thing. I don't know if you get my meaning. This is the beauty, if I can refer to it as that, of medicine, of disease, of conditions. And so you can say, okay, somebody has a particular type of rash, and maybe the rash looks like this, it's got this particular color, it's itchy, or it's this and that and the other. And that is the way it usually looks. But then you see what looks like the same rash with something slightly different. So what we're saying is that that doesn't mean that it's not that particular rash. It's just that this is an aberration or an unusual way that the rash is presenting. So the point I'm trying to make is that sometimes you could have migraine headaches that are not just on one side, but usually they will occur on one side of the head. So people who experience migraines and similar to some of the other primary headaches they could happen for many days of the week. They could last for several hours, even days. I definitely have come across people who have had bad migraines for 3, 4, 5 days. Really, really just so uncomfortable. So it can cause severe pain. It can cause recurring episodes. Migraine is one of those headaches that specialists have worked out or have broken down into different episodes or different phases. And migraine headache is just one of the symptoms of the migraine. And headaches can be quite intense. Sometimes they can be a little bit milder, but generally they can be quite intense. So we've identified that a migraine can happen in 4 distinct phases. And I'm just going to describe them briefly because not everybody experiences them, but it might be useful to know. And if you're somebody who has, 1 or 2 or all of these phases, then I think you probably recognize them. So there's the first one, which is called the premonitory phase, which is before the headache starts. And these are symptoms that a person experiences perhaps in the days before the headache actually happens, or the hours before the headache happens. And they tend not to be pain. They're not really associated with any pain, but they are a feature. And if you keep a pattern diary or a tracking diary or whatever, you might actually spot them, when you start thinking about it, that, oh, actually, this does happen to me when this headache is about to start. So some symptoms that people talk about with the premonitory phase, they might have mood changes. They might experience certain food cravings. Some people talk about yawning very frequently. I know that sounds really strange, but some might experience changes to their bowels, so they might get constipated or experience diarrhea. And some might complain about sensitivity to light and smell or sound. So all that is just something, to be honest, you probably wouldn't pay attention to it. It may not be so obvious. You might just think maybe it's something for women. You might just think, oh, maybe it's that time of the month. You may just not put anything to it. Your neck feeling stiff or tight. You might think, oh, you've not sat very well before the computer. You've been honked over the computer. You've done something. Is what you probably think. So that's the first phase. The headache hasn't started yet, but this is something going on that could be related. That we've established that is within the migraine episode, even though the headache hasn't started. The next one is the aura. And remember, I said that some people do not have these phases. So there are certain types of migraines where you don't even have the aura. But the aura refers to another group of symptoms that happen before the proper headache. And they are symptoms that affect our senses. So it could be your eyesight, it could be your touching sensation, or even your speech. So by vision or eyesight, I mean somebody with the aura may experience, just like I've got on the screen, there might be something different to the vision. They may be seeing blood vision, flashing lights, zigzagging lines, some of the things. So something different that they're seeing in their visual field. They might also experience tingling or numbness, and that might be in the arm, commonly in the arm. It might just travel up towards the face, and they can't explain it. All of a sudden, they just start experiencing pins and needles or tingling, or just some change in sensation. And that can be quite scary, especially if it's happening for the first time, because you think, is it a stroke or is it some other kind of neurological problem? And talking about scary, if the eye changes aren't enough, or the sensation is not enough, there might also be the ability to speak or even think. So some people actually experience a change to their speech. The words become slurred, so as if their tongue is too thick and they can't vocabulary. They can't talk properly. The vocabulary isn't efficient. The flow of the speech is not efficient. They might even have jumbled speech, which literally can appear as if they're having a stroke. So that can be very, very scary. There could be difficulty understanding what people are saying. So you're sat there and you can hear somebody speaking to you, but it's not making sense. They may even have trouble thinking, muddled thinking. And all that can be a symptom or an aura. And so what's really important, particularly for us clinicians, because by the time somebody comes to us with this, you'd want to think about the most the worst case scenario, the most life-threatening potential cause. You want to make sure this isn't a stroke going on, and you want to assess the individual when they come in with these kind of symptoms. So there could be people who come in with these kind of symptoms and we're worried about a stroke, and then we go ahead and do tests and do scans and we don't find anything, and then it goes away, and then the headache starts, and then we realize that, okay, this was a migraine. So we're talking about migraines. We're looking at the different phases of migraines. We've talked about the premonitory phase as the first phase before the headache starts. And these are non-painful symptoms like food craving or the mood change or being sensitive to light or sound or smell. And then we just talked about the second phase, which is the aura. And the aura is changes to sensation. So, for example, vision, the eyesight, blurred vision, seeing flashing lights or zigzagging lines, or blurred vision. We've talked about sensory changes. That could be numbness or tingling that starts in the arm, goes into the face. And then we've also talked about problems with speech or thinking. These are auras, and these are temporary changes. They're not permanent, but they can happen. And if you don't know, if this is the first time it's happening, or we don't know if the person suffers from migraines, we may think they could be mistaken for things like a stroke, a mini stroke, or even a major stroke. All right, so that's the second phase, the aura. The third phase is the headache. That's the headache proper. Most migraine headaches that we know of generally can be quite severe, but some people can have less severe or mild, if I can use that term, headache. Now, of course, it's subjective, but people can describe one headache seems more severe than the other, and so on. And severe migraine can be really debilitating. I mean, all the different headaches we've talked about so far can be very uncomfortable. But severe migraine, a pounding, throbbing head, feeling as if the head is about to burst or explode, really, really uncomfortable. Some people might also feel very, very sick. They might have watering from their eyes as if they're crying, just uncontrolled tearing. And interestingly, just to show you how complex medicine can be, interestingly, some people don't have a headache. What? How is it possible to have a migraine but not have a headache when headache is the whole point of it being a migraine? But there you go. Some people could have the premonitory phase, then the aura, and then somehow skip the headache, or maybe have a very, very mild headache. They might feel sick, they might vomit, so they may have those other changes, but not the severe pounding one-sided headache. So that's the third phase. And then the last phase is after the headache, the post-headache phase. At that point, the headache stops or the headache subsides, and people are just left feeling drained, exhausted, just not well, just as if you've been through a ringer, really. And that could be, for a few hours or for a number of days. It varies. It varies from person to person. So those are the four different phases of a migraine. But then migraine also has different types. So you can have a migraine without an aura. So a migraine in which case you don't have the aura that I talked about, those sensory changes, those don't happen. And generally, those are associated with very intense throbbing headaches on one side of the head. They could last anything from a couple of hours to 2 or 3 days. And these are people who don't generally have those symptoms like visual light flashing or numbness or tingling of the arm or the face, or any changes to their speech or thinking. That's the migraine without aura. But they may have, some of those premonition like yawning or diarrhea or what else did we say? Food craving. There's a number of different ones. So those are premonitory symptoms well before the headache begins. Then you could have a migraine with an aura, which we've described an aura. So that basically means that the aura symptoms will start. And usually they will begin just before the headache starts. It could be half an hour, even an hour before the headache starts, or 10 minutes before the headache. And it's not always, because I really want us to be clear, it's not, you might find somebody who doesn't have the aura, doesn't mean that they're not having a migraine headache. So sometimes we don't tease out these things without really sitting down and asking the questions. And again, I can't overemphasize the importance of a diary. And diary doesn't have to be anything complicated. It's just a little note of what you felt or what you thought happened before the headache started. Obviously, if you can, if it's possible, that would be really, really useful. There also, so the other different types of migraines that you might have heard about. There's abdominal migraine, quite common in children, where they always have a bad tummy. They keep having a bad stomach, tummy ache. We've checked them over. They're not constipated. They're not having trouble with their waterworks. You've examined them and there's nothing. One of the reasons for not wanting to go to school, and you think kids are just playing, but actually, and I had that experience many years ago when I was a younger doctor, and had this child that, parents were just thinking that they were playing up. And, we don't want to, I think there's certain ages when kids aren't making things up. I know that sometimes it is possible, but I would really rather that we check them out properly and make sure that there's nothing before we say, oh, they're playing up. But in this case, when we couldn't find anything on examination, work anything out, we eventually got our colleagues in the hospital involved, and this child was eventually diagnosed with an abdominal migraine. And it's what causes recurring abdominal pain. They might feel sick or they might even vomit. They may or may not even have a headache. But yeah, this is something that could affect usually young children between under the age of 10 or around that age. Okay, so migraine is more common in women. So some relationship to hormones. More common if you have a family history of migraine, and if there are mood problems like depression or anxiety or bipolar disorder, as well as sleep problems. What we talked about triggers with the other headaches. So what are the possible triggers of migraine? So stress is one. Skipping meals is another. So going without meals can trigger caffeine. Have I said stress? Yes, stress and tiredness. And then not enough physical activity or exercise, poor exercise habits. So those are the possible triggers for migraines. Now, doctors can usually, when we're trying to make a diagnosis, and I know I'm probably sounding like a broken record now because I've said it so many times, is the importance of being able to detail your symptoms. I know some people would come in and I don't really know how to describe it, is what they will say. I don't know, it's just really painful. And I appreciate it's painful, but listening to this, if you've been listening to this from the beginning, you can see how the headaches can be slightly different one to the other. Like if you tell us, oh, like it feels like a tight band around my head, that's different from this pain is really behind my eye, always behind my right eye. When you say those different terms, and we're thinking about, oh, right, this could be a tension headache, or oh, it could be a cluster headache. And that's why it's important to be able to pay attention and just try and note what it feels like. We know it's painful. It's painful, yes. But the reason we're asking what it feels like is just to see if we can, characterize it, just to help to make the diagnosis and then get the right treatment. That's how it would work. So the doctor would usually rely on understanding your symptoms, Perhaps if it's possible that you've kept a pattern diary and you can say around what time of the day it happens. If there are any triggers that you've noticed, that would be really useful, as well as everything else that's going on. If there are any other illnesses, any medication you're taking, your other personal history, your family medical history, and so on. So so that's migraine. Of course, in terms of treatment, we can look at that very, very briefly. We've not really talked about cause. I mean, well, in terms of causes, we think that there's something going on in the brain. It may be to do with the blood vessels in the brain. It may have something to do with either the blood vessels are narrowed or they are widened, or it could be to do with balance of some of the chemicals in the brain, or even the way that the nerves are communicating in the brain. We're not sure. We just think that it may be related to this. Of course, I've talked about running in family, so it may be that other members of the family have it, and then it's you develop it as well. And we've talked about the triggers, and NF gave us a perfect example. And she's talking about while she's on the pill, but there are other women who are not on the pill, but could also experience migraines around the menstrual cycle, around their menstrual period. So that's something to be aware of. Other triggers are things like stress, anxiety, diet. Diet is really important. There are many people whose migraine is triggered by alcohol, coffee, or caffeine. Not just coffee, caffeine in drinks, chocolate, nuts, cheese, citrus fruits, foods containing the additives tyramine and monosodium glutamate. I'm just mentioning these so that if you're somebody or somebody who is having headaches and we're thinking about migraines, apart from medication, we're going to come to treatment in a few moments, but apart from medication, what else can you do at home? What lifestyle changes? So you might look at cutting down some of these things or cutting them out, and that might help to control the migraines. Other triggers for migraines could be medication like birth control. Here we go, like NF told us earlier. Even HRT that women use around menopause, or even some sleeping tablets. And I think it's important, smell. There are lots of people who get triggered by strong smells, smoke, or even flickering screens on television or at the movies, loud noises, humid atmospheres, or stuffy rooms and very bright lights could also trigger a migraine headache for some people. And then usual things that could potentially, cause headaches: tiredness, poor sleep, tension in the neck and the shoulder, poor posture, low blood sugar. I should have mentioned that actually. Low blood sugar hypoglycemia is also associated with headaches, but it could trigger a migraine. And actually, having a bad headache, for somebody who is prone to migraines, having a bad headache from something else, maybe stress or something, could actually trigger a migraine. I know that sounds really strange, but if you think about it, we've said that headaches are generally anything that is pain or pressure around the head, the face, upper neck, okay? And that there are different types of migraines. We've tried to isolate migraine itself as a particular type of headache, but it doesn't mean that somebody who has migraines couldn't have the different types of migraines that other people do. That could be because they've had a busy day, they've not really eaten properly, they've not really been drinking properly. People with migraine could have those type of headaches that are because of those changes in our physiology that can be easily rectified. But if a person with migraine gets into that kind of headache, that could trigger their own migraines. So, yeah. Other interesting things I would say about migraine, we've talked about it being more common in women. Um, there's no one race that has it more often than the other, but you might find that it's maybe less reported in people of ethnic minorities, blacks and Asians. It may be less reported or less diagnosed. I think that's probably the better way to say it, because we do have health inequalities that mean that Black people are less diagnosed, or there's a longer time to diagnose, which is obviously a horrendous situation for somebody who simply because of their race is not getting the right diagnosis. But it's good to mention that and recognize that those exist, and hopefully we can work to prevent or eradicate such, those such inequalities. Okay, let's talk about treatment of migraines. I'll just have a quick look on the chat, see if there's anything. No, okay, that's great. I think we're up to date. Please don't forget to like this video. I'm not doing a very good job of reminding you to like the video, am I? Please don't forget to like the video, and of course, subscribe to the channel. We've been talking about migraines, and I hope this is really providing some people with some better understanding of migraines and headaches. So just going to talk about treatment now. And just like NF mentioned at the beginning, the simplest thing you can go for, treatment can be both medication and lifestyle changes. I've mentioned a little bit about lifestyle change earlier, but let's look at medication first, and then we'll talk about lifestyle. So commonly over-the-counter medication, simple things like paracetamol or acetaminophen, and non-steroidal anti-inflammatory medicines like ibuprofen or aspirin, which you can get over the counter. Just please make sure that you are not allergic to any of these medicines. Seek advice from your doctor. Be sure to look at the patient information leaflet before starting any medicine, to make sure it is suitable for you. So that will be the first line. Then remember we said that people with migraine might experience lots of nausea or vomiting. So they could also do with anti-sickness medicines, and sometimes you can get that over the counter, but usually from with a prescription from your doctor. Of course, if these are probably for people who know that they suffer with migraines, who have a diagnosis of migraines, and they know when they have a premonition or they have an aura, or they know the type of headache that they have. For somebody who is experiencing symptoms for the very first time, please seek medical attention. Please, so that you can be properly assessed and we get the right diagnosis. And we're not it's not a guesswork trying to decide what it is or what's causing the symptoms. So, okay, so those are over-the-counter medicines. And of course, there are prescription medicines that you could be provided with if the over-the-counter drugs don't help. But I think that I would always recommend that we go with them first, especially in somebody who is experiencing them for the first time. If it's not so severe, over-the-counter drugs like paracetamol or acetaminophen and ibuprofen can help. And you can alternate these. You can have paracetamol, and if you need something stronger after a couple of hours, you can add ibuprofen. You can alternate this. You can discuss with your doctor to make sure that you're taking the right combination, the right doses as well. So yeah, there's some prescription medicines. Some people might require a migraine preventer or prophylaxis. That is medicine that you take to prevent developing a migraine. I should have mentioned at the beginning, I'm sorry, we haven't got a cure for migraine. All we can do is treat the migraine episodes to try to alleviate the headache, to try to stop the headache. Or we can give medication to try and prevent a migraine episode from happening in the future, reduce the frequency. So for people who have really bad, frequent headaches for days, last for days, or they happen very frequently, they are the ones who are likely to have a migraine prophylaxis medicine. Some people might have migraine headaches maybe every 6 months or 9 months, not so frequently. I'm not downplaying them, but that's quite different from somebody who's having headaches every other day or every couple of days or every month, for example. So there are prevention medicines that your doctor could prescribe, and then there are prescription medicines that could help to abort the headache. Things like triptans or ergotamine, and that's an older one. Commonly we use triptans, and there are some newer drugs, and this should be discussed with your doctor so that you get the one that is suitable for you. It's always important to make sure that you get your doctor's advice. If you're taking over the counter medicine and you've had it for a couple of days and you're not getting better or it's getting worse, please seek medical attention. If it's getting worse at any point, in fact, you don't have to wait. If your symptoms are just getting more severe, please seek medical attention. It's always important. And I also want to add that it's important that people stick to the recommended dose. Always look at the information leaflet and stick to the recommended dose instead of trying to take, because you feel the headache is so bad, instead of taking the number of tablets that is recommended, you take double that. No, that's not going to make a difference. That's just, you're just going to potentially overdose on the tablet and not really achieve what you want, which is to control the pain. And you could also get another complication, which is medication overuse headache, which is a headache that develops because you've taken too much medicine to treat the headache. I know, sounds mad. So that's a new type of headache, or the old headache just feels worse because you're taking too much medicine. So please stick to the recommended dose. Speak to your doctor if you think it's not working. All right, so what can you do yourself? A number of things, and you probably guessed them from some of the triggers we talked about earlier. So it's really important to identify trigger foods or drinks, like caffeine, alcohol, that could be responsible. Getting regular exercise is important. I know that for cluster and tension headaches, some of those can be provoked by activity, but there is overall benefits of having regular exercise that has overall benefit in your health. And specifically for migraine, that actually could help to reduce, could be a preventer that could help to reduce the frequency of migraine episodes. Something else that could be useful is to address stress. So learn stress management techniques, see how you can cut down stress in your life, or learn relaxation techniques like meditation or mindful breathing. Those have been recognized to provide some relief for some people. And again, I know I definitely sound like a broken record. Keep a headache diary, a headache journal. You can put something on your phone, doesn't have to be elaborate. Or if you want to be fancy, get a journal and then just put it down. But it's really important for helping to track patterns, because you can see there's so many different types of headaches and some of their symptoms can overlap. Some of their treatments are quite different. And you want to be able to hopefully uncover what is causing yours earlier to get the right treatment. So headaches are a very important symptom in medicine. They shouldn't be ignored. And if you're worried about your headache, if it feels severe, if you're in extreme pain, if you're experiencing symptoms like nausea or vomiting, or you're having problems with your eyesight, if you're experiencing pins and needles or tingling, feeling numb in your arms or legs, along the face or the head, or if you're experiencing problems with speech, your speech is slurred or jumbled, you feel confused or muddled, you're struggling to understand what people are saying, can't think right, struggling to move one side of your body, having fits or seizures. If you used to suffer with migraines, but all of a sudden they've changed, the headache type seems to have changed, it feels worse, please contact your doctor urgently, please. Okay, so I think that's everything I wanted to cover about migraines. It's a huge topic, and I don't think we're going to exhaust it in one session, but I really wanted people to have the opportunity to think about migraines. And of course, if you've got any questions, I'd love to hear. If you think we should do another video looking at hormones and headaches specifically, then yeah, let me know in the comment section and I can look at doing that for you as well. But yeah, hopefully if you've sort of listened to this from the beginning, then you're sort of clearer in your head about headache and how migraine is a type of headache and what migraine feels or could look like and so on. But thank you so much for spending this evening, this mothering Sunday with me. Shout out to all mothers, and hope that the week ahead is for everyone is full of good news and good experiences. And I will see you again soon. Thank you so much for watching, guys. Don't forget to give this video a like as you leave, and I'll see you again soon. Bye.